Hi everyone, welcome to Physio News Network, June 2026 edition, where research meets recovery. I'm your host, Girish Srinivasan, registered physical therapist from Insta Physiotherapy and affiliated clinics. Every month, our mission is simple, to bring you the latest research, the most relevant clinical guidelines, the newest innovations, practical exercises you can use immediately, and inspiring patient success stories that remind us why we do what we do. Because science is important. But science only matters when it changes lives. In this June 2026 edition of PNN, we will discuss a brand new assessment tool for patellar tendinopathy. The truth about strength training and fall prevention in older adults. The latest APTA guideline for ankle sprains. The growing evidence behind red light therapy. And a fascinating cranial nerve exercise that can influence posture and movement. And finally, we're going to talk about a remarkable functional neurological disorder recovery story from one of our patients from Insta Physical Therapy and Neuro Rehab Clinic. So, let's get started. Our first research review we're going to talk about today is an outcome measure called Tendons P. Tendons BINS Tendons P. This is the next generation assessment for patellar tendinopathy, which is kind of the pain in the quadriceps tendon over the knee. Let's begin with the research update that may change how we assess jumper's knee. Very common with basketball players, runners, tennis players. For years, clinicians have relied on the P questionnaire to evaluate patellar tendinopathy. It has been useful, but researchers have identified several statistical limitations, including concerns regarding reverse scoring and measurement validity. That led to a development of a new outcome measure called Tendons P, or Tendinopathy Severity Assessment Patellar. That's expansion for that. So clinicians should check that out. This patient-reported outcome measure evaluates three critical areas. First, the pain level. Second, the functional ability of the patient. And the third, pain experience during loading activities such as jumping, running, squatting, and sports participation. Patients can complete it in approximately 4 to 9 minutes. You can always send it to the patient before they come to the clinics, they can fill it out, or if they have time in the clinic before the appointment, they can fill it out. This gives you very much valuable information about the condition. Why this is important? Because successful rehabilitation requires accurate measurement. If we cannot measure improvement properly, we cannot optimize treatments. So, Tendons P provides clinicians with a more comprehensive picture of tendon health and load tolerance, allowing better tracking of recovery throughout the rehabilitation. So the clinical takeaway here is we emphasize objective measurement. Whether it is tendinopathy, concussion, stroke recovery, vestibular dysfunction, or FND rehabilitation, at Insta Physio and our associated clinics, what gets measured gets improved. And Tendons P may become an important tool for clinicians treating patellar tendon disorders in the coming years. That's the first research review. The second research review we're going to discuss at today's PNN is resistance training and fall prevention in older adults. Now, let's talk about something that affects millions of seniors worldwide: falls. Falls remain one of the leading causes of injury, hospitalization, loss of independence, and reduced quality of life among older adults. A massive systematic review involving 92 studies, almost 6,000 participants at an average age of 73 years. When we investigate that, what we investigated is whether resistance training truly improves gait and fall related outcomes or not. The findings were impressive. Resistance training produced large improvements in strength, moderate improvements in walking and performance, significant improvement in timed up and go performance test, which is a test physios conduct usually. You sit in the chair, you get up and walk for 3 meters and come back and sit down, and we measure the time. That's very important for us to see how is your gait speed and balance and stability and your performance. So that is called tug or timed up and go performance test. So this exercises improved significantly the timing and the quality of the tug, and also it improved walking distance, sit to stand ability, and gait speed. However, the researchers made an interesting observation. When resistance training was compared to other active interventions like walking programs, stretching, or multi-component exercise programs, the difference became much smaller. In fact, the greatest advantage of resistance training was seen primarily in talent or timed up and go performance. So what does this mean actually or clinically? The magic is not simply lifting weights. The magic is movement, consistent movement, progressive movement, purposeful movement. The most successful programs included supervision, progressive intensity. Because the common mistakes we do as clinicians is we underload our seniors. We think, oh, he's old. We only give them 2 pound or 3 pound or 5 pound dumbbell or kettlebell. We underestimate their ability. So we need to up our intensity a little bit. And it has to be progressive and it has to be supervised. And other programs included squats, leg press, calf strengthening, and knee extension exercises. So these are all very important things for older adults to do to prevent falls and improve the gait speed. A lot of our seniors say, what do you do for exercises? Oh, I walk every day. I always tell them, walking alone is not enough. You need to do more than that. And we have to guide them. So our message to older adults, age does not weaken us. Inactivity does. Strength remains trainable at 70, at 80, even at 90. Every squat, every step, every repetition, it is an investment in independence. And that investment pays remarkable dividends. So we have seen 2 research reviews now. We'll move on to clinical practice guidelines. So APTA 2021 clinical practice guideline for lateral ankle sprains. Ankle sprain is very common injury as you know. So let's review that, how it has to be treated or approached with proper guidance. So the updated APTA clinical practice guideline emphasizes several key recommendations for both acute ankle sprains and also chronic ankle instability. So the key message number 1 is do not underestimate an ankle sprain. Many people just think, oh, it's just a sprain. But up to 40% of individuals may continue experiencing symptoms and instability long after initial injury. Especially I've seen people with 2 or 3 ankle sprains without proper treatment, and they come to me with a lot of pain and instability in the ankle. Ankle instability just does not affect only ankle. They are your feet, they are your kind of wheels. When the wheels are not working properly, it's going to cause problems upstream. Your knee, your hips, your lower back, your neck, your shoulders. So do not ignore your ankle sprain. Key message number 2 is early protected movement is encouraged. Complete immobilization is generally discouraged except in severe cases. Movement promotes healing. Movement restores confidence. Movement restores function. So remember that. The third key message is balance and proprioceptive training are very essential. The guideline strongly supports single leg balance training, dynamic stability exercises, neuromuscular retraining, sport-specific progression to reduce recurrence and improve outcomes. The fourth key message is assessing dorsiflexion mobility. Dorsiflexion is the ability of the ankle to come up. It's only about 20 degrees. But restricted mobility in that movement is a known risk factor for recurrent sprains and persistent dysfunction. So you make sure you consult your healthcare practitioner, physiotherapist, to identify if you have a dorsiflexion limitation or not and do exercises to work on it. So at Instant Physio and affiliated clinics, we just don't treat just the ankle. We restore the entire movement system because the ankle influences the knee influences the hip influences posture, and posture influences performance. So it's all matters. You have to check the upstream. So that is your clinical practice guideline of this PNN episode. Let's move on to the innovation of the month. So what are we going to discuss? We're going to discuss about red light therapy. It is a hype or science. Red light therapy is not new for physiotherapy. I remember using infrared lamps in my college days in 1994 to 1998. It's about 30 years, 40 years old. So now the new company is bringing in new type of red lights with LEDs and different modes, combination of infrared and red light and all those combinations and advanced technologies. Before we used to have just one red lamp like this, but now you can have a lot of small LED lights which you can control how many lights can come on and different modes. And red light therapy is one of the fastest growing technologies in rehabilitation today. And the way it works is called the photobiomodulation. How does it work? Current evidence suggests that red and near infrared light can influence cellular metabolism, through mitochondrial stimulation, potentially increasing your ATP production and affecting inflammation and tissue repair pathways. I know that's a mouthful. So those are the good things of red light therapy. Research also demonstrated potential benefits in pain reduction, inflammation management, tissue healing, and recovery from certain musculoskeletal conditions. And also don't forget wound healing. It also has a big role in wound healing. And not only infrared, ultraviolet therapy too. There are protocols for that. Emerging evidence also reports applications in tendon rehabilitation when combined with exercise program, because tendon needs loading. Whatever modality you use, it does not matter. You have to load the tendons progressively. Conditions showing very promised benefits with red light therapy are tendinopathy conditions, osteoarthritis, neck pain, back pain, wound healing, sports recovery, and also post-surgical rehabilitation. So, red light therapy is not magic. It's not substitute for exercise. It's not substitute for rehabilitation. It's a tool. Like every other tool, outcomes depends on proper assessment, appropriate dosage, and integration into a comprehensive treatment plan. At Insta Physio and our affiliated clinics, technology never replaces clinical reasoning. Technology amplifies it. Whether it's red light therapy or laser or focus shockwave or neurocatch or bioness, we have a lot of advanced technologies in our clinics, but they never ever replace a good treatment plan with exercises, manual therapy, and collaborative practice. So we have seen the research reviews, we have seen the clinical practice guidelines, and we have seen the innovation. Now let's move on to the effective exercise of the month. Cranial nerve exercises for better posture and movement. This month we explore an exciting brain-based exercise involving cranial nerves 3 and 4, right, which are your oculomotor nerve and the trochlear nerve. These nerves help control eye movement. Why does that matter? Because eye position influences head position. Head position influences posture, and posture influences movement, and movement influences pain. So the exercise we're going to talk about today is diagonal eye tracking exercise. Let's go through that. Sit upright, keep your head still. Slowly move your eyes upward and inward, then downward and outward. Basically, I'm just moving eyeballs in different directions. You can also follow an imaginary diagonal line, or you can use two pens like this. You can follow the eyes to the pen. Here to here, here to here, here to here. So basically you're working on your eye tracking. Perform about 10 repetitions, then reverse the direction. And why it works? This exercise stimulates eye movement. It controls pathways that communicates with your vestibular systems, cervical joint position sense receptors, and postural control networks, and also your motor planning centers, which is in your frontal lobe. So, because this third and fourth cranial nerves is nucleus or in your midbrain, which is part of your brainstem. So, when those information goes there, that sends communication to other parts of your brain as well, which controls your balance, your neck, your postural controls, and also your motor planning and execution. I'm going to do a separate episode on cranial nerve exercises and how it helps your pain, movement, and postural control. So you will learn more about this later. Many individuals with neck pain, balance dysfunction, concussion symptoms, functional neurological disorder, and postural disorders demonstrate altered visual motor control. So improving eye movement quality can improve overall movement quality. As we often say, movement starts in the brain before it appears in the body. Now, the last segment of the PNN network, our success story of the month. Today I'm going to share a very interesting story of this girl, a teenager. Her name is Luca, and she gave me permission to share her story.
I'm Luca Fuller, and I was diagnosed with functional neurological disorder back in the States at around 16 or 17, and I had to use a wheelchair because I was a huge fall risk because my legs would just give out randomly or they would shake whenever I walked. I've done this program for around 3 months now, and now I can properly walk without a wheelchair or any sort of aid, and I have been able to move forward in life. I'm looking to get a job and I'm looking to go back to university, and it's been looking really hopeful In the States, there weren't many options for functional neurological disorder. There weren't really any treatments that I could afford. So I really only had my wheelchair and general checkups and pain medicine. But then when I moved to Canada, I went to InStep and I started their InStep's functional neurological disorder program, and then I started getting proper treatment, and I started feeling actually very hopeful about my future as a person, and I was able to do so many new exercises and so many simple things like walking.
So what is the most important part of every PNN episode? The people. Because behind every diagnosis is a human story. When Luca first arrived at Instant Physiotherapy, she had been using the wheelchair for nearly 2 years. She had functional neurological disorder. Her walking was severely impaired. Her confidence was gone. Her hope was fading. Many people had told her what she could not do, but we focused on something different, what she could still do. Using a comprehensive FND rehabilitation program that included motor retraining, sensory weighting, sensory integration, visual and vestibular strategies, attention shifting, graded exposure, cognitive functional therapy, cognitive behavioral therapy, confidence rebuilding, along with the team of kinesiologists and psychologists, and neuroplasticity-based rehabilitation. Luca began taking small steps. First, we trained it in standing, then small steps. In the parallel bar, then walker, then crutch, and then cane, and then now nothing. Then bigger steps, then longer walks. And within 4 months, she was walking independently. Not because we fixed her, but because her nervous system relearned movement. Her brain and nervous system felt safe to move. Her brain rediscovered ability. So, message for anyone living with FND, that is, recovery is possible. Recovery is real. Recovery does not always happen overnight. But the brain has an extraordinary capacity to change. It can change every moment. And when science, hope, effort, and the right rehabilitation approach comes together, remarkable things can happen. So, thank you for joining me for the June 2026 edition of Physio News Network. Today, we learned that better measurement improves tendon rehabilitation. Strength remains one of the best medicines for aging. Ankle sprains deserve serious rehabilitation. Red light therapy is an exciting emerging tool. Eye movements can influence posture and movement. And most importantly, the human brain remains capable of extraordinary recovery. If you found this episode helpful, please like, share, and subscribe. And if you or someone you know is struggling with pain, balance problems, neurological conditions, concussion, dizziness, functional neurological disorder, or any neurological conditions or mobility challenges, reach out to our team at InStep Physiotherapy and our affiliated clinics. And we can put all our affiliated clinic links in the description below. So we have about 15 clinics in and around town and in Redwater, Sherwood Park, and Beaumont. So until next month, keep moving, keep learning, and keep believing in the incredible ability of the human body and brain to adapt, heal, and thrive. I am Giri Srinivasan, your registered physiotherapist, and this is Physio News Network. See you next month.